Who in your practice should be doing the 3D printing? Hey, I'm Dr. Chris Griffin, founder of the 3D Printing Association for Dentists, and this is the video series that helps you get 3D printing started in your practice. If you'll just take a minute to subscribe to this channel, we're going to be putting out tons more content for you guys. And if you get a chance, give us a thumbs up because it really helps other people find us as we try to promote 3D printing in our profession of dentistry. So who is the person that needs to be doing the actual 3D printing in your practice? Okay, well, let's go through the obvious suspects. There's only a few types of people in your practice. We know the patients aren't going to be doing it, right? So that leaves the doctor or the staff. Now, if you're a doctor that loves 3D printing, that is awesome, and that may be why you're watching these videos. Very soon you're going to go ahead and buy your stuff, buy your printer and your accessories, and you're going to move forward and you're going to be doing all kind of stuff, all kind of really awesome, fancy, technical stuff. But what if you're a dentist that sees the amazing opportunities in 3D printing but knows that you're just not really the kind of person that's going to be the one that's actually implementing it in your practice? In fact, you really need one of your trusted team members to do it for you. Or even better yet, you're thinking, well, 3D printing, you know, maybe I could just get my lab to do it. Well, let's get that out of the way right off the bat. So number one, a lab person could do your 3D printing. Well, if it's an external lab, I mean, back when this first started, there was a lot of, you know, hullabaloo about 3D printing is going to lower lab cost. Well, that really didn't happen. In fact, if you're like me, you started seeing lab costs creep up because you started to get charged for 3D printed models that you used to get for free when they poured them up in stone. That's no good whatsoever. And that's what we're really trying to combat here, right? And I'm not trying to really dunk on the labs because I understand their challenges they're having right now too, right? But you just can't up my lab bill and say, oh, it's because now we're 3D printing models. That's just not right. So if we want to 3D print stuff in our practice to save money, which is a huge benefit of this whole program, we've got us, and we've already said maybe you don't want to do it yourself. So if you want to, great, but let's just say, no, you don't want to do it. And you know it'd be better if somebody on your team did it. So now we have the team members. So who on the team could do it? So really, if you think about the auxiliaries in the practice, you've got the front office. Usually these people are not really of a mind to get into the technical aspects of dentistry, and that's great because the stuff they do, I wouldn't want to do either. So it's probably not your front office people, although there are exceptions to every rule. So that leaves your hygienists, and it leaves your chairside assistants. Okay. Hygienists. Now, look, I love my hygienist, but I can tell you that change and learning new things, it's not the kind of thing that I see a lot of hygienists just absolutely loving. Once again, exceptions to every rule. There are hygienists that want to do all kind of crazy stuff. That's amazing. In fact, one of my hygienists actually does all of the tray production for the clear aligners that we produce in my office because we're 3D printing the models. So that's great, but you know, it's rare. And most dentists report back to me, my hygienist likes their space the way they like it. They like their own stuff. They don't like to change rooms. They like to make it into their own little territory with pictures and licenses on the wall, and they just want to stay in that room and they just want to do their thing and then go home. That's great. If that's what your hygienist wants to do, you're in the majority. You're 90% of America. So that tells you right off the bat, asking a hygienist to do your 3D printing for you, it's going to be a little bit of a challenge. Their personality is not really geared toward that normally. It's not what's common, okay? So that leaves your chairside assistants. Now this is where we found the most luck with all the offices we've trained. The chairside assistants generally, they're the ones that are taking alginate and pouring up stone anyway, so you're replacing that with 3D printing, which is amazing. So now, even though they're going to grumble a little bit for 2 weeks, just expect that to happen. After 2 weeks, it's going to be fine. I actually in my own practice had to rip the stone grinder out of the wall over Christmas break in 2020 to get my own staff to stop using the stone, you know, the alginate and the stone, okay? Even me. And I'd been 3D printing for 6 months and trying to force it on them. And every now and then I would walk down the hall, I'd still see it, you know, they're pouring, taking an alginate and they're choking somebody and they're pouring up stone. It's crazy. Even I had this problem. But once you get through that barrier and they see the benefits of the office, they see the speed it brings to the office, how much easier things are, they seem to be the natural person to take this job over for the dentist, okay? And hopefully with a little dentist supervision on the front end. And here's what I'm going to tell you guys is like the dream, right? So this is what we did, and I think it's the best way to go, but it's not the way you do immediately. Like, you don't just immediately say, oh, I'm appointing one of my chairside assistants to be the 3D person in the office. Gradually, we worked toward a system where my lead chairside assistant started doing so much 3D printing and so much, then she took over the 3D scanning that had to lead toward the big 3D cases. Now she's basically what I would call the 3D auxiliary in the office. The 3D printing expert, the 3D scanning expert. She's the, you know, she's now in charge. Now she's the expert on the cone beam also. She's just my 3D expert auxiliary in the practice. And that's what I would love to see you guys move towards. And actually we're so busy with it in my practice. Now this is her area. I built her away from everything else. She doesn't even have a role chairside anymore. And I hired someone else to take her place in the clinic because she does so much with the 3D printing. And so that, I think a chairside assistant, that's going to be your way to go, Doc. Learn it yourself, and that's great, but assign it to someone, best case scenario, a chairside assistant you can really trust that sort of takes the ball, runs with it, and makes this, gets it implemented and just makes it work in your practice with your own unique set of things that you would like to do. So, okay guys, get that chairside assistant trained up, allow them to become a 3D printing expert in your practice, and you've got a big winner. Okay? All right. So, yeah, that's it. Hey, go to our website if you would like some free resources, 3dpa.org. That is, you're going to find, you know, I think we have some free checklists there. We have a free report. We're going to, as time goes on, we're going to add more and more free stuff. That's your thing, 3dpa.org. Go there, grab the resources, and we'll see you next time.